We'll talk about what kind of surgery is being used the most: open, laparoscopic, or robotic surgery. So let's get started. According to the report, the use of various surgical techniques in Italy in 2023 breaks down as follows: open surgery, 46%, laparoscopic surgery, 45%, and robotic surgery, 9%. From 2018 to 2023, robotic surgery has shown a steady increase from 6% to 9%, which is interesting because the increase has been consistent over time. The report also talks about the efficacy and clinical impact of robotic surgery when compared to other techniques. Overall, the report concludes that robotic surgery seems to offer certain advantages, particularly in terms of reduction of blood loss, which is a significant benefit across different surgical fields. For instance, in gynecological surgery, the use of robotics leads to a substantial reduction in blood loss when compared to both open and laparoscopic approaches. Similarly, in urological surgery, robotic surgery reduces blood loss compared to open surgery, and in bariatric surgery, it decreases blood loss compared to both open and laparoscopic surgery. In terms of safety, the report indicates that the rate of complications does not differ significantly between robotic and laparoscopic surgery. However, it is important to note that robotic surgery has the lowest rate of major complications, especially in gynecology, where it is associated with fewer wound infections and blood transfusions. Moreover, in gynecology, robotic surgery results in shorter hospital stays. When comparing oncological outcomes, the report suggests that robotic surgery may offer certain advantages in terms of reducing lymph node retrieval rates, which could potentially impact staging and treatment decisions. In terms of functional outcomes, robotic surgery shows promise in specific areas such as urology. For example, after radical prostatectomy for prostate cancer, patients who undergo robotic surgery experience better urinary functional recovery compared to those who have open surgery. However, it is important to acknowledge that the report also discusses the costs associated with robotic surgery. The direct costs of robotic surgery are generally higher than other approaches, mainly due to factors like the cost of the robot itself and specialized staff. While robotic surgery can reduce hospital stays, it doesn't lead to a significant enough decrease in costs to offset the increased expenses. In terms of economic impact, the report indicates that the highest costs are driven by the length of hospital stay and the number of procedures performed rather than the surgical approach used. Therefore, increasing the number of procedures performed using a surgical robot can lead to cost savings, but only up to a certain point. Interestingly, the report also addresses the potential reasons behind the observed outcomes. It suggests that the use of energy devices during surgery might contribute to the reduced blood loss seen with robotic surgery. Furthermore, the report highlights that the benefits of robotic surgery may not only lie in its technical advantages, but also in the enhanced training and specialization of the surgical teams using this approach. Finally, the report concludes with some recommendations for future directions. Further deepening research on efficacy and safety, evaluating the actual economic impact to inform future decisions, ensuring proper resource management, optimal organization of the operating room, and high-level specialized training for staff are all crucial next steps. So what do you think about the data presented in the report? Are you surprised by the findings? Let me know in the comments below. If you found this video informative, please consider leaving a like and subscribing for more updates. And if you want to watch more videos like this, you can do so here. Thanks for watching, and I'll see you next time.